эй, стиги я уठान.
Спасибо. Так, стиралась. Veins. We have three main veins.
Первый лен.
Так, students, the first main vein, the internal jugular vein.
Yes, ma'am.
It starts from the jugular opening of the base of the skull, descends and drains into, connects to the subclavian and forms the brachiocephalic vein. The main. The second main vein of the head and neck and external jugular vein. And last, the third is the anterior jugular vein. Internal jugular vein has got two types of the tributaries. Intracranial tributaries take blood from the internal structures of the skull. Sensory organs, nasal cavity, oral cavity, and from the structures of the cavity of the skull, sinuses, brain. And extracranial tributaries take blood from the external structures of the head and neck. I will start from intracranial tributaries. Intracranial tributaries include some groups. First group is the sinuses. Students. The main tributaries of the main intracranial tributaries of the internal jugular vein are represented by sinuses. First sinus, the superior sagittal sinus, inferior sagittal sinus, and between you can see the rectus sinus. Rectus sinus drains into the confluence sinum, the increasing part of the transverse sinus, and continues into the transverse sinus. Down you can see below occipital. Occipital divides into two branches. The transverse sinus continues into the sigmoid sinus. Sigmoid sinus reaches the jugular opening, and jugular opening is the place of starting the internal jugular vein. The sigmoid sinus continues into the at the level of the jugular opening, below jugular opening, we have increasing structure of the superior internal jugular vein, the bulb, superior bulb, and this place for inferior bulb. Students, inside bulb, internal jugular vein has got the valves. For prevention, the
backflow.
да. Так, next sinus is superior petrosal sinus, inferior petrosal sinus. Students, between inferior petrosal sinus on the clivus you can see the basilar plexus. Basilar plexus connects the opposite inferior petrosal sinus and occipital sinus to each other. And around sella turcica, around hypophyseal fossa, we have the venous ring. This ring is formed by four sinuses, right and left in the cavernosa sinus. You should remember previous classes. I explained the pathway, the internal carotid artery. Internal carotid artery passes through this sinus. And between right and left carotid sinus, you can see sinuses, you can see the intercavernosal sinus, anterior and posterior. And this ring, venous ring, has got the tributary. The sinus is called the sphenoparietal. Sinus. The sinus goes along the lesser wing of the sphenoid bone. First, main intracranial tributaries of the internal jugular vein. Second, students, second tributary is represented by meningeal vein. Meningeal vein take veins take blood from the meninges.
Meningeal layer.
Да, dura mater,
Diameter.
arachnoida and
Diameter.
так, diameter, да. Next group of the veins lies on the brain. And students, these veins are called the cerebral.
Cerebral.
We have peripheral cerebral lie on the cortex, and deep. Deep is located inside. The main deep vein is called the greater vein of the brain, vena cerebri magna, the major vein. This vein take blood from the deep structures of the brainstem of the brain and drains into the rectal sinus. Rectal sinus. Так, sinuses first. The first one, meningeal, cerebral. Так. Next group lies inside internal acoustic meatus, and this group is called auditory veins. Auditory veins take blood from the
Internal
labyrinth, ossel and membranaceous labyrinth, passes through internal acoustic meatus and drains into the sinuses. The telachoroida and telachoroida continues into the vena cerebri magna. Vena cerebri magna is here. The plexus horridus, and vein. Так, 1 second. I will show on the picture. Just 1 second. Guys, look at the rectus sinus. This vena cerebri magna. It starts from the deep structures.
Brainstem.
Thalamic, mesencephalic, a lot of veins from cerebellum, from pons. Так, next group is the ophthalmic veins. Ophthalmic. We have two ophthalmic veins, superior and inferior. Superior starts from the supraorbital and dorsal vein of the nose, dorsal and supratrochlear. These veins connect to each other and form vena ophthalmica superior. Vena ophthalmica superior passes through superior orbital fissure and drains into the cavernosal sinus. Cavernosal sinus, students. It's very dangerous location because the sinus, cavernosal sinus, is formed by a lot of cellula, small cellula. And the inflammatory process can pass via vein superior and I forgot trauma can pass through vessel and into
Cavernous
sinus and we has got for providing the blood from the cavernosal sinus, the patient can die. It's very dangerous location, position. And inferior cavernosal or inferior orbital vein. Inferior orbital vein has got the tributaries from anterior surface of the face, the labial, small veins. These veins passes through intraorbital canal, this vein, intraorbital vein, lies on the infraorbital groove, and we have two variants for draining. First variant into the pterygoid plexus, pterygoid plexus between pterygoid muscles, and second into the cavernosal sinus. Often this vein drains into the pterygoid plexus. Так. And pterygoid plexus connects to the superficial veins of the head. Так, sinus, meningeal, cerebral, auditory, ophthalmic. And, just 1 second, emissary and diploic, да? emissary and diploic vein. Так, diploic vein. Students, this brain, the dura students, this dura mater, this sinus, this skull, bone stuff, skin, and the substance, ossel substance of the skull bones is called the diploia. The diploia is formed two ossel lamina, and between ossel lamina you can see the spongiosy ossel tissue.
Spongiosity.
Да. Inside you can see the vein. This vein, the wall of the veins fuses this bone. This bone. And the blood can pass without problem through this vein. Students, these veins are called diploic. These veins take blood from the diploic substance of the bones of the skull. We have four main diploic veins. This veins is located inside bones. This just projection. Frontal diploic vein from frontal region. Two temporal, anterior and posterior from temporal and parietal region. And occipital from occipital region. All diploic veins drain into sinuses or emissary vein of the head. Students, and last, main tributary. This tributary has got position between intracranial and extracranial because this tributary connect the intracranial and extracranial and is called emissary vein. Emissary. These communicating veins, students, and they connect with the sinuses and superficial veins of the head. If the patient has got the problem for passing of the venous blood from the brain, for instance, the depression of the arterial blood, the increasing of the vessels, the veins, and the blood can't pass from brain well, and maybe tumor. Maybe tumor at the level of the neck, and tumor presses the internal jugular vein, and we have problem with this blood circulation. And blood uses the emissary veins for passing, for providing. We have four emissary veins. First vein is located at the level of the parietal bone. Parietal bone has got the foramen parietalia. This foramen contains the parietal ethmoidal or parietal emissary vein, which connects the superior sagittal sinus and superficial veins of the head. And blood from the superior sagittal sinus can pass through emissary vein outside. It's regular vein. The second regular vein, emissary, is located inside condylar canal and is called the condylary emissary vein. These veins connect the sigmoid sinus and vertebral plexus of the cervical region. Around vertebral canal we have the cervical plexuses, venous plexuses, vertebral plexus. This plexus, just 1 second, I should explain this plexus.
Yes, ma'am.
Can I draw?
Yes, ma'am.
Students, vertebral column has got the venous plexus. This plexus is located around and inside vertebral column. inside vertebral column. That's transverse section, да? Body. Так, this spinal cord, meninges.
Yes.
Так, and vertebral column. So, a lot of muscles, structures. Значит, so around, inside and outside, we have venous plexuses. This plexus is located on the posterior surface of the arch and on the anterior surface of the body. Both plexuses is called plexus venosus vertebralis. This anterior, external, да? External, because it's located outside, externus, anterior, posterior, and posterior. This plexus take blood from the muscles, vertebral column, spinal nerves, meninges, and from internal structures. Inside, between meninges and vertebra, we have second plexus. This plexus is called
Intervertebral
plexus venosus vertebralis internus. So, and in front of anterior, behind posterior. Okay, posterior. This plexus take blood from the meninges and spinal cord. Connects to the external. External drains into intercostal. Intercostal veins. Да, this vein is called the intervertebral veins. Intercostal. At the level of the thoracic region. Cervical region, there as we have the vertebral vein. Vertebral vein inside is located inside transverse process, and intervertebral veins drain into the vertebral vein. Vertebral vein. Lumbar region, lumbar vein. Sacral region,
Sacral vein.
And here in cervical vein, there is also transverse cervical vein.
No. This inside vein is called the this was vertebral vein. Vertebral vein and artery inside transverse process. This branch intervertebral vein. Intervertebral vein drains into vertebral and posterior intercostal, lumbar, sacral. If you see cervical region, vertebral, thoracic. Да, intercostal, posterior intercostal, lumbar region to lumbar. Because we have very long vertebral column and very long. It's very important information, students. I forgot previous class explain. We'll explain this material because next part after major control we will study the veins of the abdomen.
Abdomen thorax.
Inferior caval and portal, and I will explain very important information about anastomosis between three main systems of the veins. And you should know this plexus because this plexus contains a lot of anastomosis between superior and inferior portal veins. Caval veins. And around vertebral column, you can see here now what this place of location of the internal, external. You can see the external venous vertebral posterior. This internal, this anterior external inside. Internal venous plexus, and around foramen magnum, we have the plexus, venous plexus of the vertebral column, and condylar canal contains the condylar emissary veins, which connects the sigmoid sinus and this plexus. Так, students, mastoid. Mastoid is located here behind on the. You can see You can see the mastoid opening. Mastoid opening. Irregular opening. This place of location the mastoid emissary vein. Third vein. This vein connects sigmoid sinus and occipital superficial vein of the head. And last, occipital. Students, occipital emissary vein is irregular, inconstant, because the openings of the squama, of the occipital squama, can ossificate, and this vein may absent. This vein passes through openings, irregular openings of the occipital region, and connects the occipital vein and confluence sinus. Да, this emissary vein. Emissary vein. Ну, проводен venous blood. Так, so, guys. That's all information about
Head.
intracranial. Intracranial. Extracranial. Just from cavity.
अब आएगा सही अपना अब अपना है सीधा।
Muscles. Так, students. Extracranial tributaries. Superficial temporal vein. Superficial temporal vein is as a result of connection the frontal parietal branch and has got the tributary. No, this. Just 1 second. Just tributary. Just 1 second.
External cranial.
Very small. Here. Middle temporal vein. Middle temporal vein connects to the branches, tributaries of the superficial temporal. Superficial temporal passes in front of pinna and drains into the internal, first variant, internal jugular vein or retromandibular. Retromandibular. Да, retromandibular. Continues into retromandibular. Retromandibular passes behind mandibula and drains into the internal jugular vein. Tributaries of the external retromandibular veins. Сейчас, students. Так, retromandibular veins passes behind mandibula. Retromandibular vein. This superficial temporal. This retromandibular. Superficial tributaries, the maxillary veins. Maxillary veins take blood from the pterygoid plexus. Pterygoid plexus has got tributaries like branches of the maxillary arteries. Inferior alveolar veins, superior alveolar veins, meningeal veins from muscles, masticatory, from mimic muscles, and students between pterygoid plexus and facial vein, we have anastomotic vein, vena faciae profunda. This vein connects. Vena profunda faciae, the deep vein of the face.
Deep facial vein.
Deep facial vein. This vein connects the pterygoid plexus and facial vein. Students, retromandibular drains into the internal and connects to the facial vein. Facial vein, you can see here, facial vein starts from the medial angle by angulary vein. Angulary vein connects to the dorsal vein of the nose. Dorsal vein of the nose is the tributary of the superior ophthalmic vein. You should know this pathway, like arteries. And descends external vein of the nose, superior labial vein, inferior labial. Inside we have the deep facial vein, crosses the
Body of the
mandibula,
mandibles.
suprahyoid, suprahyoid, and can connect can connect to the lingual
Lingual.
and drains into the internal
Interjugular
vein, the lingual vein. Lingual vein.
Mm.
Lingual vein. Vein. Da.
Three lingual veins.
The sublingual, tributary, sublingual,
Dorsolingual.
deep and
Dorsal,
dorsal.
deep.
That's archioid and drain. Sublingual, deep
And
and dorsal. Da, dorsal. So, next tributary, superior thyroid. Superior thyroid, superior laryngeal, and from superior part of the and middle thyroid. No, middle thyroid, this absent, maybe here, maybe a little piece of the middle from not
Middle part of thyroid.
thyroid gland.
We have the inferior, but inferior thyroid vein is tributaries
Brachiocephalic vein.
brachiocephalic. We have three types of the two inferior and one impaired. Vein,
Impaired.
Unpaired vein. Unpaired thyroid vein. Let's name impar. Impar thyroid vena thyroida impar and inferior. One or three veins. Так, and last pharyngeal students, but pharyngeal is absent. No, maybe here. Little piece. Maybe pharyngeal. Да, from pharyngeal plexus and from pharynx.
Pharynx.
Так, external jugular. External jugular vein. Occipital and posterior
Auricular.
auricular. Да, goes along the
Sternocleidomastoid muscle.
sternocleidomastoid muscle and connects to the retromandibular.
Retromandibular.
For passing of the veins from the internal jugular vein and drains into the venous angle between internal jugular vein and
Subclavian vein.
subclavian. And anterior starts from the chin, goes between second and first fascia, third fascia, take blood from the skin and forms the anastomotic arch between two
Internal jugular vein. Anterior jugular vein.
the anterior jugular vein can connect to the external and drains into the angle, venous angle. Так, superior thyroid here, superior thyroid, laryngeal and tributaries. Так. Что ж, сейчас I forgot. That's all. Сейчас я сейчас
Madam, transverse cervical vein.
Transverse cervical irregular vein. Can you show the neck, just neck. I want to show
लाल
the
दिख रहा.
not.
इसमें नहीं है, इसमें नहीं है.
Can I touch? Can I? Da? No problem. No,
No.
invisible on the. I want to show the external jugular vein.
इसमें दिख जाएगा. Yes, ma'am.
Someone white, like
Tak,
lighter tone.
Shine.
इसी के में देखें. अरे देवा.
Prolapses. Tak, one second. No. This. Look at you can see elevation. This vein. This one is the external jugular vein. This. Tak.
मैम एक मार के चेक करो ना.
Oh.
इसमें भी दिखेगी.
Вот это. This is.
अरे निहान का
You can see external jugular.
पूरे ऐसे तो दिखती है तुम्हारे. शिवम भी चेक करेगा तो
शिवम मत चेक. बिल्कुल ब्लैक नहीं दिखेगा.
देख.
Stop.
Yeah, ma'am, just take one slap.
Ma'am, this line.
Come out.
Stop.
यही तो है ना भाई, यही तो है.
हाँ, यही कुछ थी. मेरे को पता नहीं चला मेरे में क्या
अरे
दिखा. ये जो आ रही है. मेरे में दिखा है बता.
मैम फ्लैश ऑन करे.
उठ रही है. देख ना रही
मेरे में
है.
कह रहा है, मेरे में देखेगा.
तेरे में तो दिख जाएगी. और हड्डी है ना अंदर ऐसे भी.
क्या था?
This internal, external common carotid artery is located deeper than this vein is superficial under skin. And if you have the more light color of the skin, you can see the blue or green color of the veins. But your
Covering.
skin, да.
Protective cover.
But no, your neck more dark. No problem. Ага. Вот. Да, yeah. Да. This projection this way. Superficial, да? External. Так. Ага. This one is. Да, external jugular vein. Да.
Oh my boy.
एंगल बन रहा था एनास्टोमोसिस से
वो कांच किस एंगल पे ड्रेन कर रहा है वो
The difficult material. Да, next is major, да.
वहाँ पे ही तो angle बनता है।
Arteries and nerves.
So,